Hi there, Andrew Zang, Physical Therapy here, and today I want to talk a little bit about the IT band or iliotibial band, which is this band of tissue that runs down the outer part of your leg, and for a lot of people can lead to some outside knee pain. It could even be associated with people who have some outside hip pain as well. And this is an injury that I had over the course of running and intermittently over the years. It's something that a lot of runners deal with, but it is also something that an ordinary person just walking around living life can also deal with. And that's what I want to talk a bit about today. What it is, and is this being blamed for more, and what can be done to help it out. So again, it's this thick band of connective tissue that runs down the outer part of the leg, and it helps kind of join in a lot of muscles. Beyond that, it doesn't serve a big function other than to be tight or annoyingly painful for individuals. And if you actually kind of press and dig at it, people who don't even have pain will probably be sore. And that's a normal occurrence. So that in itself is nothing to worry about. But so again, one of the most common things, again, is outside knee pain. And people will notice this, again, running, could be walking downhill, definitely walking down stairs, could be an uncomfortability sitting and transitioning back up to standing after sitting, are some of the most common things that people with this issue report. And when I first had an IT band injury with running, the trainers that I was working with in high school and college, they had me trying to stretch the IT band and doing this and that. But honestly, stretching didn't seem to do much for it, because the potential to stretch this band, the tissue, really isn't there. What I've come to learn over my own injuries over the years and learning more about anatomy and how the body works, stretching isn't the answer. It comes down to strengthening. And strengthening what? You might ask. So one of the number one things that you need to strengthen when you have an IT band issue is your hip muscles, your gluteus medius, to be more specific. This muscle helps to control how your pelvis moves, and also how, and by virtue of controlling the pelvis, how the lower leg moves. And so improving how the pelvis moves, it can reduce strain further down the chain towards the knee, and thus reduce some strain on it. One of the most helpful things that can be done. Number two, we need to look down towards the feet. So everybody has probably heard the term pronation, and people use pronation like it's a bad thing. It happens with every single step that you take every single day. So that in itself isn't the problem. Some people may stay in pronation a little bit longer. They may have a difficult time pulling out of it because of weakness that they may have in their foot. So if we can address some of the weakness that an individual has in the foot, that can also improve the mechanics on up the chain to the knee and also reduce strain. So I've had clients ask me, well, I have this outer knee pain, why aren't you treating my knee? And usually, I say, well, let's just try something first, and we'll either work something at the foot or up at the hip, and then we retest that knee pain that they have, and 9 times out of 10 it's better. And it's then that people start to understand the connection that the foot has to the knee and the hip has to the knee. So that's the big thing for IT band. If I was to sit there and just do soft tissue work or stretching or ultrasound or massage, those are passive interventions, and it's probably not going to result in anything positive for the patient. But if we do some kind of active intervention, strengthening exercises, maybe we need some mobility out of the foot or the hip, those can be hugely, hugely beneficial. So people are going to ask, what's the best exercise? And honestly, there are multiple ways that you can strengthen the foot or the hip, and the answer is going to rest with the individual person, how their body moves, where they're strong, where they might not be as strong and they need to work a little bit, and when somebody sees that through testing, and that could be watching them squat with both feet on the ground or a single leg squat, watching them perform a step down or how they step up under step, provide vital cues for the provider to pick the right exercise for the individual who's struggling with IT band pain. So if you are somebody who's struggling with outer knee pain, or even if it's towards higher up towards the hip, there are plenty of things that can be done. And it comes down to just taking that step and getting an extra pair of eyes on the situation to help point you in the right direction. Because once you get pointed in the right direction and you learn what to do for it, most people can clean this up and get back to doing what they want to do pretty quickly once they know what to do. So if you're out there and struggling, know that there is help, there is a solution, and if you're looking for that solution, post in the chat bar, send me an email. I'm more than happy to continue this conversation so that I can help you get back to enjoying what it is that you enjoy doing, be it running or cycling, swimming, or just living your life, walking and gardening and hiking and enjoying vacation, things like that. So again, any questions, let me know. Otherwise, have a nice day.